Righty. All right, guys, good morning. Dr. Lipo Gyno. Got this young man, he's 44, from Texas, who comes for gynecomastia surgery. Now, he wants me to tone it down a bit, and I don't know how to tone anything down. It's you know, I deliver the 63 AMG, not the, Honda Accord. But we're doing gynecomastia here. So he's got the meats here, and it's a little bit more than just gland. You know, if anybody would just open that up, take an ice cream scooper, he's going to have a big donut hole and a big thing, and that's horrendous. So we're going to be sculpting him, but we're going to, as I said, tone it down. No abdomen, no lipo filling. He even fought me to go over here, but look at this junk here. We got to get that, man. We got to make him look like Hercules. Get that etched hockey stick look there. Also do the the lats back here. He's got some skin tags. I'll just snip that out for him while he's numb. Get that triangle, going. And I want to go to about here, not down to the belly. Lately, I've been doing that even for free. But with my curved cannulas, I'll get down here, get the midline linea alba a little bit, and just a hint of the six-pack, actually four-pack. 1 and 2, 2, 4, right there. And get the linea alba coming down. Just, again, with me, it's about lights and shadows. That's what really makes things artistic. When the lights hit things, you see the shadows and the depressions and the fat where you want to keep it, and extract fat where you don't want it anymore. And sometimes even add fat where you want to enhance. But again, we're not doing that. We're going to tone it down, a bit. So local anesthesia, stealth incisions, armpit, and by the nipple, obviously on both sides. No in the belly button today. No drains today. Anyway, let's hop to it. So here we're going to frame him. That's the midline. Lift up here. And that's the semilunaris. Just easy. Just easy. No showboating here. A little showboating. A little showboating. Boom. So now, push down on my shoulder. Good. And I want to just see where his lats are. And go down to where I call the maximum point of indentation. Do the same thing over here. Push down. There you go. And I'm going to maintain this volume there. And again, go down to the maximum point of indentation. Now, notch up there. It's got a little difference. One side's a little bit bigger than the other. That's normal. And that's about it. Nothing more than that. Lift up again. Let me make that even. This one's one side is a little bit bigger than the other. And that's it. Good. Get a little bit of serratus muscle here. We're over here. Little one there. Guys, so we're gonna start numbing them more. Go slow. You know where I am. And we pump you up.
To pump you up.
This hydro dissects the gland. Low pressure. Hydro dissects the gland so I can, liposculpt it out. Think of it like a peach pit, like a peach. Get all the meat, and then you lipo that out, all the meat, and you have the pit, which is tiny, or like an avocado pit. So you don't have a concavity. With me, it's the way I do it. It's an impossibility to get a concavity. Yeah. Now. So we're using the 2-ring short because you want to be relatively conservative, if that's what Lipo does. So we're not going to go down as far down because he wanted to be relatively conservative in what I do. So what I'm going to do is spend some time. He's got these glands here. Good. You all right? Good. Gonna bombard the gland with these ultrasound energy to really melt. So we're doing 4 here. Man, those glands are tough. Oh yeah. Boy. Let's get under it. There we go. So the Vaser helps to melt the fat prior to liposuctioning. So it mixes into butter, pretty much. Butter fat. And so it makes it a lot smoother when you get it out. The results are you know, traditional liposuction, you create tunnels and you kind of, you know, deal with that.
Is that where you can get like dimpling?
Dimpling and lines. You know, with the Vaser, it kind of undermines the skin, as you said, separating it, and makes it into fluid. Also, the Vaser technology, I can get into the armpit, and it does not injure the vessels. It does not injure the nerves.
1 minute before.
So you really are protected. And you're not doing it forceful. You know, you're going really gentle. I mean, seems like it's not, but comparatively to the lipo, it kind of is. It's not as aggressive. Because, well, the lipo isn't, because you're more, you know, just sucking out
30 seconds.
what you've melted. Gotcha. All right, guys, so here we're going down to the semilunaris to create some interest. You know, again, with high definition lipo, it's about the shadows and the lines. It's about extracting fat where you want it, don't want it, leaving fat where you want it, and even enhancing muscles where you want to enhance. Muscles include the pecs, the glutes, you do the lower back. Sometimes you do the arms, we do the, what do you call it? You do the delts even. If we do it nice, which we always do, and melt it, less amount of, you know, removal of tissue that you want to kind of save, and then you won't have any kind of concavity. But we'll make sure that that never happens. Okay? So you go from this side up into the armpit. Got it. Beauteous. Beauteous. Now I'm going to go down here to get any kind of tail of it. So you want to get that. This again, you want to etch a 6-pack. No, I'm sorry, not a 6-pack. You want to get that hockey stick look. And then I'm going to give them like a little bit of a 4-pack. Very subtle. I can handle that. So here, again, the semilunaris. Give them some hint of shadows. There we go. And heading on down to the side. Again, Vaser is great technology. It keeps harms away from any kind of blood vessels, nerves. Really just concentrates on fat and gland tissue. This is a perfect procedure for this. And now I'm going down, etching the lats. 10 seconds. Good. So, since we're doing, he's restricting me on the belly, I'm using the shorter one. It's still a Mercedes, 4mm, a little bent to it. Mercedes, it's not made by Mercedes, it's got a 3-star design to it, basically. And my markings, I redid the markings, and we wash them down, as we always do. Good. And now we are sculpting the muscles. And that's what I do. I had to fight him to be able to do this. But I won. So, self-incisions, we start at the armpit. And you can see the quality of fat that's coming out. Very nice. Get down to the lats back here. Use my smart hand. And really push down. I put select pressure on where I want. Get down to the sides of the lats over here. And I can really dig in there, and actually I can bring his shoulder all the way up, almost like I'm dislocating his shoulder to accentuate that lat. And again, I'm not going to lipo the fat from the lat, so I want to maintain that volume there. Every once in a while, we'll hit and run. Especially with me, I'm, etching the muscle. That's perfect. And again over here. So you can see the definition starting already. Now I'm going to get to the inferior pec to start to get under the gland and etch the hockey stick shape. And that's the beauty of this bent cannula. You right? Get on top of the gland. And I can get down to start etching top of the 6-pack. On this side, etching the edges. Good. Semilunaris. Purposely
All the way up.
Yeah. Purposely didn't numb all the way down because I want to restrict my enthusiasm. Curb my enthusiasm. I'll go a little below it just to feather it, of course. Getting under this in the perfect of the bent. I can scoop it through. Get under it and really scoop it. So I can feel my hand. I can really get around the side here. Again, I want to create minimal disruption. So if I can lipo this as much out as I can, but you always have to get in the gland there. Get the gland out. Getting the serratus muscles a tad better. Every once in a while, this is a Mercedes, same as I used on that one. That one was bent. That was bent about 20 degrees. This is now curved 30 degrees. And you can see I can get the other way around. Just a lot easier getting to certain areas that I want to enhance. Get down this way. Get around there. Yeah, I don't use it as much. With this guy, I'm being conservative. As conservative as I can be. Again, I can get the serratus muscles a little bit better. Oh, sorry about that. Same thing here. A little bit better. And get it around this. Small incision too. Okay. All right, guys. All right. Very interesting. Important. You got to get the gland out. People, doctors, patients come to me and says, "Oh, my doctor was afraid." You got to get it all out. You can't leave anything in there, because it will grow back. Especially if this dude wants to get on, something, testosterone or something. A shorter one, because I don't have to go down to his back and stuff, so I have these short ones, just more efficient and localized. So this looks beautiful. We have a scissor here. Things are all on, open. So this one is a little different. This has 2 ports. You can kind of see it a little different. See a little look here. See that? So you you go through the same thing. It's a little thinner. You right? So drains are used when there's big glands, all right? It just saves a lot of heartache of fluid and stuff. If there's little glands, you know, it's only gland removal. We can do the quilting stitches. Always with lipo. I don't use quilting stitches because the area's been you know, kind of opened up a lot more. But my philosophy is always prevention of any problems, and I've done enough of these to know if and when problems are going to happen. We don't want any problems. And as you can see, the incisions are stealth, and they're going to heal up great. Lipo Gyno, perfect case of Vaser high definition power assisted liposculpture, Gynecomastia gland removal, and Renuvion J plasma to tighten everything up. This is a 44-year-old gentleman, as I said, from Texas, and these are the glands. They're pro-hormone, he confessed, that he took when he was dumb and young. And he said he took a bunch of things, and he doesn't even remember what he took. The right side was bigger than the left, pure gland. We got out, I don't know, 16, 1,600 cc's of fat, and I sculpted his lats, his pecs, and the upper six-pack abdomen. He wanted to keep it at a minimum, but you know, this is what I do, so I had to talk him into doing the lats, the upper six-pack, the serratus, and after the gland, we did the Renuvion J plasma. Midline linea alba, semilunaris, and the upper six-pack, just to give him some pop, some pizzazz. So if you have gyno, you call me Dr. Lipo, 631-424-0101, or email me at johnlepotsmd@gmail.com. Thanks, and see you soon.